Hello, my name is Ayla Wolf. I'm a doctor of acupuncture and oriental medicine, a licensed acupuncturist, and the owner of Healing Response Acupuncture and Functional Neurology, located in Stillwater, Minnesota. Today in this video, I wanted to talk a little bit more in depth about a loss of smell as a result of a COVID-19 infection. Before we get into the research, I want to go over a couple of terms. So one of the terms is anosmia, and that means a loss of smell. Another term is cacosmia, which means that normal smells are perceived as offensive. And then we have hyposmia or microsmia, which means that people have a diminished or a partial loss of smell. And then there's dysosmia, which means that there is an altered sense of smell. So it's important to realize that a lot of the research at the beginning was only focused on people who had lost their sense of smell, and there hasn't been a whole lot of research focused on people that are having these sometimes very disturbing alterations in smell, where suddenly all meat products smell like rotting flesh, for example. Or I have a patient who, when she's sitting in her living room, she would suddenly start smelling what she described as like an old ashtray full of cigarettes, or this kind of like stale cigarette smoke. So I've had, I would say, more patients that have come to see me with these disturbing and frustrating alterations in taste and smell, as well as people that have, again, either a total loss of smell or a partial loss of smell. So it's important to kind of distinguish these things, at least clinically when I work with people, because what I find is that a lot of times the phantom smells and the alterations in smell actually improve first before people start to regain their normal sense of smell for, smelling different scents. The other thing that is really important to recognize is that a loss of taste and smell, or these alterations in taste and smell, these are very serious issues and they can have pretty important ramifications. We rely on our sense of taste and smell to keep us out of trouble. We need to know if our house is on fire. We need to know if a food is rotten and shouldn't be eaten. Our sense of taste and smell are part of our survival instincts. And when we lose them, that can actually create a lot of anxiety and contribute to a lot of emotional distress. And then as part of, just enjoying life too, when that loss of taste and smell is present, suddenly people don't get satisfaction out of eating food. And so in that case, people can have a tendency to either undereat and lose weight, or they can start overeating and gain weight because when they do eat, they never feel satisfied. So this, again, loss of taste and smell and these alterations in smell and taste, they have serious consequences, they have long-term consequences, and they can definitely have an impact on people's emotional states too. So it's very important that we figure this out and help people to regain taste and smell. I'm going to talk a little bit about research first, and then we'll get into what we're doing at our clinic to actually help with restoring a sense of smell. So first, I want to talk about some of these proposed mechanisms for why this is happening in the first place. And at first, people thought, well, a loss of smell might just be related to the same mechanism as when people get a head cold and they have sinus congestion and sinus inflammation and a loss of smell in that circumstance. But we're finding that many, many people with a COVID-19 infection have no other sinus symptoms. They don't have a runny nose, they don't have sinus congestion, they don't have these typical rhinorrhea symptoms, and yet they have a profound loss of smell or these alterations in smell. So it became very clear very quickly that this is very different mechanism than just, say, a common head cold that creates some local inflammation in the sinus passages and might temporarily affect smell. So then they were wondering if the COVID-19 infection actually causes a loss of the olfactory receptor neurons. So is there nerve damage as a result? And what they realized is that a typical regeneration of those nerves takes 10 to 15 days, but there were people that were having a clinical recovery from their loss of smell within 4 to 7 days. So if it was purely damage to these olfactory receptor neurons, then it would take every single person probably 10 to 15 days or longer to regain their sense of smell, and that wasn't the case for a lot of people. So they started to think, well, maybe it's not these olfactory receptor neurons. And indeed, when the research started looking at these neurons, they also were not finding widespread evidence of damage to these olfactory receptor neurons. However, they were finding severe damage to a specific support cell called the sustinacular cells. So, in order for our olfactory system to work, in the olfactory epithelium, we have what are called sustinacular cells. And what they have found is that this virus causes a massive degeneration of the olfactory epithelium, specifically these sustinacular cells. And these support cells are closely associated both metabolically and functionally with the olfactory neurons and this transduction of odorant signaling. So essentially, in order for the olfactory receptor neurons to function, they rely on sustinacular cells to make sure the whole system works. So when we take those away, it does cause changes in the olfactory transduction. But that brings us back to the question of why are some people having such long lasting alterations or loss of smell? And so, one of the, again, proposed mechanisms and what the histology studies are looking at is the fact that the inflammation that can occur as a result of the COVID-19 infection can actually create scar tissue formation in that olfactory epithelium. So once you have scar tissue formation, it actually becomes a big barrier to that epithelial lining to be able to recover and start working again. So that is, I would say, at this point, one of the most well researched local effects is this idea that sustinacular cell death causes damage to the workings of the olfactory system. And when there is scar tissue formation in that olfactory epithelium, that prevents recovery and regeneration of those tissues. Approximately 2 weeks ago, there was a larger scale study that was published that was comparing brain imaging scans of people that had not had a COVID-19 infection to patients that had a COVID-19 infection. And they did indeed find structural changes in the brains in specific regions that were associated with the processing of taste and smell. So again, this is a question that is still being heavily researched. And at this moment in time, in April of 2022, we are now seeing that there is some evidence of changes in brain areas related to the processing of taste and smell. And there may be scar tissue formation in the olfactory epithelium, along with damage to these support cells for the nerve functioning and the transduction of olfactory signals. So that's where we're at right now as far as our research and scientific understanding of what can cause an ongoing loss of smell or alterations in smell. But what I think people are more interested in is what can we do about it? In our clinic, we are using a three-pronged approach with acupuncture, Chinese herbal medicine, and intranasal light therapy devices to help with improving circulation and reducing the scar tissue formation or breaking down scar tissue formation in that olfactory epithelium, as well as improving blood flow and circulation into that orbital frontal cortex and trying to reduce the damage from inflammation in that area that is also affecting people's sense of taste and smell. As I mentioned at the beginning, what we typically see is that those phantom smells go away first before the normal sense of smell starts to come back. And that trajectory is very different for everybody. So for some people, they've been able to regain their sense of taste and smell rather quickly. And for other people, it can be a rather long process. So it often depends on the length of time with which they've had the loss of taste and smell. That makes a big difference as far as the prognosis. But the good news is that we do have therapies and techniques that we are using. We have seen them working. And if you have more questions about that, don't hesitate to reach out to us. Our website is www.healingresponseneuro.com, and you can email us at info@healingresponseneuro.com. Thank you again for watching this video. I hope you found it helpful and informative. Again, my name is Ayla Wolf. I am the owner of Healing Response Acupuncture and Functional Neurology, located in Stillwater, Minnesota. Have a great day.